Assalamualaikum doctors. In this video, I am discussing a recall communications that is about febrile convulsion. So febrile convulsion, as usual, we are started with IRCAP, and we give the task is that febrile convulsion is fourth time. Mother needs workup. We tell that just reassurance, red flag, and advice. So first, what are febrile convulsion? So febrile convulsion are a type of fit seizure that is triggered by a high temperature in a child. They normally happen between the age of 6 months and 5 years. Approximately 5 in every 100 children will have febrile convulsions by the time they are 6 years old. So febrile convulsion is a one kind of seizure which is triggered by the high grade of fever. So, 6 months to 6 years is the age ratio, and approximately 5 children occur in around 100 people. So what are the causes of febrile convulsions? Febrile convulsion occurs when children have a temperature usually above 38 degrees Celsius. They can be more common if someone else in the family has had them before. Children who have common viral illness such as ear, throat, and chest infections and bacterial infections such as a UTI may develop the high temperature. So febrile convulsion occur in children who have usually more than 38 degree Celsius temperature. They can be more common or someone else in the family he had before. And more than 38 degrees Celsius, remember, and any fever like IENT, chest infections, UTI, these fever that aggravate. Then what are the signs and symptoms of febrile convulsions? Febrile convulsion can be very scary for the parent and or caregiver. However, they are unlikely to cause to harm your child. So it is looks scary. We know that most febrile convulsion last between 1 and 5 minutes. Your child will become dazed and confused, and they may fall to the floor. And your child becomes stiff, and both arms and legs may start jerking and twitching. Their eyes may roll backwards. Many children will emit or soil themselves or may bite their tongue. After the convulsion has finished, your child is likely to be sleepy. Febrile convulsions are described as either simple or complex. So simple convulsion will last less than 15 minutes and will not happen again during the same illness. Okay. And the complex convulsion will last more than 15 minutes, affects only one side or part of the body, and or happen again within same illness. So what do you do if a child is having febrile convulsions? This is very important to ask you. First of all, try to stay calm and make a note of the time when the convulsions start. So you will be calm and note how long it is going. Stay with the child while the convulsion is happening. Ensure the child is safe from the harm and move any hard or sharp object from nearby. The safest position in which to put the child is the recovery positions, and their head tilted slightly backwards. Loosen the any clothing, especially around the neck. Then, if the convulsion lasts longer than 5 minutes or the child does not recover quickly, then you call 999. And if this is the child's first convulsion, they should be reviewed by a doctor. So when febrile convulsion will be calm, the parents calm, they will be count the time. Normally 1 to 5 minutes it will be okay. Then the child will ensure that any sharp object or anything not harming the child, any tight clothes, necklace around the neck or eyeglasses will put off this. And the convulsion lasts longer than 5 minutes, then we call the emergency 999. And if the child is a fast convulsion, he will be reviewed by a doctor. Can febrile convulsion prevented? Unfortunately, febrile convulsion cannot be prevented. They usually happen at the start of illness when the temperature is rising rapidly. You can give paracetamol 4 to 6 hourly. You must not give more than 4 doses in 24 hours. Ibuprofen 6 to 8 hours. You must not give more than 3 doses in 24 hours. So remember, 4 doses we are giving paracetamol, not more than 24 hours, and ibuprofen is 3 doses within 24 hours. This will make your child feel more comfortable and reduce their temperature, but they do not prevent the convulsion from happening. You must encourage your child to drink lots of fluids when they are unwell. So drinks of fluid. It is not advised that you cool your child down by using water. So not making the child cold by using water, stripping down and using fans directly on them, but you should remove extra clothing. Can a child have more than one febrile convulsion? Yes. Children have a 1 in 3 chance of having another febrile convulsion during their episodes of illness. The risk is higher if number 1, the child at the time of the first seizures was younger than 18 months. Number 2, the child's seizure occurred with low grade fever. Number 3, there have been multiple seizures in the same febrile illness. Number 4, there is a family history of febrile seizure. So they are asking the risk of higher when it repeated occur. Number 1, the child has younger than 18 months. The child low grade fever, the seizure occur. Family history, seizure occur. Then the mother may ask, is my child at risk of developing epilepsy? The risk of epilepsy after febrile seizure is 2.0 to 7.5%. Risk of developing epilepsy is lighter. Number 1, family history of epilepsy in a first degree relative. Existing neurodevelopmental delay, existing cerebral palsy, history of any complex febrile seizure. Most children do not develop epilepsy with simple febrile seizure. The risk is about first 5% with complex febrile seizure. The risk may increase with family history of epilepsy and existing brain damage. So, is it going to be epilepsy? If asked that, very rare, very few percentage, and there is some risk factor we can tell that, like family history, cerebral palsy, family history of epilepsy, multiple complex seizure, seizure with low grade, then it can be developed epilepsy. So this is all about febrile convulsion communication. Thank you.